Hello and welcome to my channel. And as you all know by this time, this is all about community medicine. And if you are new to this channel, please do subscribe to this channel and be a part of this academic journey. Well, today's particular video, you can almost consider it as the ultimate guide in decoding the community medicine theory examination, that is for your upcoming university exam. Well, we will be taking up a lot of probable long questions and discuss them in length. I have tried, assembling the question papers from different medical colleges and find out which questions have emerged a favorite with the examiners and what's the probable pattern of this year. So let's go through this decoding journey and learn what are the do's and don'ts that you need to know to crack this. And whether you belong to any medical college, this is a must-watch for you. The ultimate guide to crack this community medicine theory examination coming ahead. So what are you waiting for? Come, join this academic journey. Now let's start with the long questions. One of the very important long question probable this year is something built around the different levels of prevention and the modes of interventions. Well, it can come in the form of a direct question. As you can see in the question number B, enumerate the levels of prevention, the different modes of intervention in each level, and then it can be discussed in context of any disease. The favorite ones are mostly hypertension, diabetes, and coronary heart disease. In this context, the natural history of disease is also a probable combination. Apart from the levels of prevention, another very important question this year is the indicators of health. And along with, there may be enumeration of either morbidity or mortality or MCH indicators. And along with, there may be, certain specific indicator description like infant mortality or maternal mortality rate or ratio, the case fatality rate, the secondary attack rate, or there may be, associated, BMH questions in regard to the health indicators, like bringing down the perinatal mortality in your block, or maybe, bringing down the neonatal mortality, the maternal mortality. So it is good to, go through these things. And regarding the indicators of health, I have often seen, students getting confused with the determinants of health. The determinants of health are very different from the indicators of health. And while writing this, you need to define what's the indicator of health, what are the basic attributes like it is valid, it's reliable, it's specific, it's sensitive. And along with, you put down the categories of indicators like the mortality indicators, the morbidity indicators, the nutrition and status indicators, and so on. And coming to morbidity indicator, again, it's a very mistake-prone indicator of all, because people, tend to confuse morbidity with mortality. Morbidity is about sickness and mortality is concerned about death. So this common mistake of putting down neonatal mortality rate or maternal mortality rate in the form of morbidity is absolutely unpardonable mistake, and you better stay away from it. So the morbidity indicators that you should absolutely mention is incidence and prevalence. Apart from, there is a big list of morbidity indicators in your textbooks. Do check them out and always have a framework for bringing down certain indicators in your blog and how to approach these questions. Then is the explain with example the different modes of transmission of communicable diseases and discuss its importance in relation to COVID-19 pandemic. Well, like last year, even this year, COVID-19 is a favorite with examiners. It can come in this format, or it can come in the form of, prevention and control of COVID-19 sudden surge of cases in your block as a BMOH, or maybe as a, designing a study to associate severity of COVID-19 with, some factors like maybe obesity or some other comorbidity. Another important question is the one around screening. The screening tests, the criteria for good screening tests, features in context of any particular disease like diabetes may be given. Outbreak investigation is also another question for which you'll find a framework given by me in one of my previous videos. Do check them out. Regarding outbreak, again, the common diseases which are given are hepatitis B, food poisoning, dengue, and malaria. Beside this, there may be, given the diagnosis and management of certain important diseases, particularly leprosy and tuberculosis. Disaster is another important from the exam point of view in your batch in particular. So you need to prepare the disaster preparedness in context of one with respect to cyclone, another with respect to flood. The probabilities of coming this in the form of a BMH question is more likely. Besides this, the classification of epidemiological studies, the importance of the incubation period. Here in this context, I would like to mention that you should have a good understanding of median incubation period, extrinsic incubation period, intrinsic incubation period, and like in this particular given question, the steps of epidemiological study for assessing bladder carcinoma in a Thai industry. So they may be basically, asking for any steps of epidemiological study. The favorite ones are case control, cohort, and RCT. So you need to know the basic steps of these three epidemiological studies. Another important question is about the low birth weight, the factors causing low birth weight, the common complications, the essential interventions for newborn, and should know how to frame certain key messages for the mother. Another important question is around the dog bite ones. Like in this one, a 30-year-old male attending the outdoor with a scratch and without oozing of blood on his left leg inflicted by a pet dog of his neighbor last night. The dog is not vaccinated. What is your diagnosis and how do you manage the case? Well, the description may vary, differ. There may be mentioning of oozing of blood. There may not be any mention of oozing of blood. There may be explicit mention that there is no oozing of blood, or there's maybe just written that there is a bite without the mention of oozing of blood or not. So you have to, judiciously clinch your diagnosis, and in this context, I would emphasize on the fact that you should rationalize that why are you diagnosing the case to be either category 2 or category 3, whatever may be the case. You need to provide your rationale behind it. And coming to the management, one of the common mistakes again committed in this area is that often you do not mention the name of the regime that you are recommending in the management of the case. Whether it's the SM regime or the ZEREB regime, you need to mention them. Apart from this, another important question is built around the antenatal and postnatal care of mothers. So the danger signs, the components of care of the mother attending the sub-center, you should have a good understanding of this. Besides this, the primary healthcare principles, the octagons of primary healthcare, the preventive and promotive activities carried out at the BPSC level. In this context, it is also important to know the staffing pattern at each of these healthcare delivery tiers. As you all know that healthcare delivery in our country follows a 3-tier delivery system, and hence you need to know the services delivered at each of these tiers and the staffing pattern of these tiers. Regarding the nutritional oriented questions, the concept of balanced diet, the nutritional problems in India, the nutritional assessment methods, and this come in context of a particular age group like the under 5 or maybe an adult or a pregnant woman, as well as some important health programs related to the nutritional requirements. In this context, this year ICDS has been a major favorite. In some colleges there have been direct questions on ICDS, and in some colleges there has been indirect ones, like the one mentioned here, that is the services provided by most important national initiative to promote the under 6 child nutrition in India. This under 6 is pointed towards ICDS. Apart from ICDS, one of the important national health program that you should definitely give a thrust this year is RMNCH+A, NBBDCD, NPCDCS, because one of the relevant diseases in this context may be mentioned, and you may be asked to put down the management in context of the national guidelines. So it is good to know this particular health programs. Apart from this, ergonomics, social security, ESI benefits, the factory acts are important things to know. Besides, pneumoconiasis from your chapter of occupational health is also popular this year. The pneumoconiasis types, factors, and how to prevent. Maybe given even in context of coal mines, how to prevent this surge of pneumoconiasis could be a probable one. Now coming to one of the most important questions this year, that is around the levels of prevention as well as the natural history of disease. Well, it is always good to go for tabular presentation or flow diagrams instead of continuous write-up, which is often very distracting for the examiner to find out whether you've really included the important points. So always underline what your main headlines are and then write beneath it or put it in a tabular form as shown in this slide. See here, I have put down the different phases of natural history of disease and accordingly put down the levels of prevention and the aim at preventing, that what it aims at preventing at that level. Like in pre-pathogenesis phase, the levels of prevention are the primordial prevention and the target population are the susceptible ones. And it aims at preventing the emergence of risk factors. That is, risk factors are not there and that it doesn't emerge anymore, that is taken care of. In the pre-pathogenesis, it is about primary prevention, and again the population is about the susceptible population. And it aims at preventing the emergence of disease. In the pathogenesis phase, it is about the secondary level of prevention, and the target population involved is the asymptomatic population. And it aims at preventing the emergence of disease and its complications. In the pathogenesis, the other level of intervention is the tertiary prevention aimed at the symptomatic population, and it aims at emergence of disability prevention. So basically the primordial prevention is focused on the whole population, establish conditions to minimize the health hazards. So advocacy for social change is one of the major interventions under it. Then is the primary prevention to prevent disease before it develops, which may be addressed to the whole population or selected to certain healthy population. And it is delivered through primary health care. The secondary prevention is mostly directed at the high-risk population, and the interventions involved are the early diagnosis and treatment. And here you mentioned the treatment regimes. And in tertiary prevention, obviously, it is targeted on the patients to prevent deterioration and aims at rehabilitation. So, the interventions under primary prevention are health promotion, specific protection, and in the health promotion, while you are writing in context of any disease, be it diabetes, be it hypertension, be it coronary heart disease, you have to build your answer on certain basic points. What are those? That is the health education, environmental modification, nutritional interventions, lifestyle and behavioral changes. So these are the basic points which you are going to build with respect to the particular disease given in the question paper. Now coming to specific protection, you have to mention the immunization, the chemoprophylaxis, the use of specific nutrients, the safety of drugs and food in context. Now coming to the secondary prevention level, the early diagnosis and treatment are the major interventions, and screening for disease, medical examination and pre-placement examinations, basic talk points. Coming to the tertiary prevention, disability limitation and rehabilitations, and here the major points which you are going to build in context to any disease given is about the recovery, the remotivation, the restabilization, the resocialization, the retraining of the patient and reintegration. So always remember, the primordial prevention is the adaptation of strategies during the phase of glucose tolerance in context of diabetes mellitus to stop the emergence of the risk factors before they have appeared. The preventive measures comprise the maintenance of normal body weight through adoption of healthy nutritional habits and physical exercises. And primary prevention in context of diabetes mellitus is possible during the stage of pre-diabetes, that is impaired fasting glucose or impaired glucose tolerance test, before the diabetes mellitus is overtly developed. Secondary prevention in this context would be preventive strategies that are carried out after diabetes has been detected to prevent or delay the development of long-term complications of the disease. And tertiary prevention would be carried out at the stage when the complications have already set in, but the aim is preventing the progression of such complications. Now, in context of hypertension, again your build-up would be through primordial prevention, preventing the emergence of risk factors like obesity, inadequate physical activity, stress, tobacco use, harmful use of alcohol, consumption of unhealthy diet, through population approach at this stage by awareness programs, screening for hypertension risk factors, and then primary prevention to be aimed at a phase between pre-hypertension going on to hypertension, and this will be aimed at the high risk approach, and the strategies involved would be lifestyle modifications, dietary changes, weight reduction, increasing physical activity, cessation of smoking, reducing alcohol intake, and from hypertension to early complications, that is the secondary prevention level. Here the aim would be at a good control of hypertension, and the strategies would involve screening for the complications. Tertiary prevention would focus at the phase from early complication moving on to end stage complications, and it would involve the treatment of the complication. The strategies involved would be the management at primary healthcare level of early complication, and if necessary referral to tertiary centers for late complication. So this is basically a skeletal framework that I am giving you to build on your questions Now coming to another important question, that is what are the indicators of health? Now here one common mistake often committed by the students is that they mistake the indicators for the determinants, and often they write pages over explaining the determinants. But here you need to mention what is an indicator, what are the basic attributes of it, that is if it's valid, reliable, sensitive, specific, and then mention the major categories of indicators like morbidity indicator, mortality indicator, nutritional status indicators, socioeconomic indicators, and so on. Now coming to the second part of it, that enumerate important morbidity indicators and discuss the infant mortality rate and case fatality rate. Now coming to the morbidity indicators, one of the commonest mistake is often students confuse the morbidity indicators for the mortality indicators. So instead of mentioning the morbidity indicators, we often find the copies are full of crude death rate, specific death rate, neonatal mortality rate, whereas these are not morbidity indicators at all. Morbidity indicators are the incidence, prevalence, admission rates, and so on. And coming to infant mortality rate, again while writing this, I have often seen the numerator part is mostly right, but the denominator, some people are writing 1,000 total birth, or 1 lakh total birth, but it shouldn't be so. There's a specific denominator, there is a specific numerator and a multiplier. And here the multiplier is usually 1,000 and the denominator is total number of live birth. The numerator being the number of infant deaths. Coming to the case fatality is also sometimes people confused with proportional death rate and things like that. But case fatality is the number of fatal cases due to a disease, which is the numerator. The denominator is the number of cases affected due to the disease. So deaths due to the disease and total number of patients affected with that disease multiplied by 100. Now coming to another important question, that is the waterborne diseases, and write down the principles of chlorination of drinking water and breakpoint chlorination. Whenever you are answering any such question, try to answer it in a structured fashion. Like waterborne disease, instead of just bulleting and writing down viral hepatitis, typhoid, MBBS, schistosomiasis, try to give it in a structured way, as mentioned here, like those caused due to the presence of an infective agent and those caused due to the presence of an aquatic host. And that also break down into viral ones, then bacterial, protozoal, helminthic, and leptospiral. And in the aquatic one, presence due to snail causing schistosomiasis, presence due to cyclops causing guinea worm and fish tapeworm. And in this context, do go through those chlorination principles. What is breakpoint chlorination? What is residual chlorine? These are important things to know. Now coming to this particular question, mention the beneficiaries and services provided under ICDS scheme. Write the different methods to assess the nutritional status of a community. Well, this ICDS is very important, and as I mentioned earlier, then it may come in a direct fashion like this question, and it might come in an indirect fashion also, that mention the services provided under the most important national health program for the under 6 children. Then also that it is being talked about ICDS only, and Instead of the different methods to assess the nutritional status of a community, it can come in context of a particular age group, maybe for the under 5. So here you know how to write it. You have to write down the services, the target group, and the services provided by. That makes a very structured answering. As you can see here, we have mentioned the supplementary nutrition, immunization, health checkups, referral services, preschool education, nutrition and health education, and along with, I have also mentioned the target groups in each of these categories. So there are different methods actually to assess the nutrition status. There are direct methods, there are indirect methods. So you should segment your answer accordingly and mention depending on the age group given. Now, another very important question, as I said, even last year it had come, and this year also it's quite probable. That is, there has been a relative slowing down of reported cases of COVID-19. A sudden surge of several cases happened in last 1 month. As a BMH, what measures would you suggest for its control and prevention? Well, your answer will be, built with 2 basic points in mind. That is, one is the IPC, another second one is a WASH. IPC is the infection prevention and control, and WASH is the water and sanitation and hygiene, all these in mind. And you have to incorporate points like triage, early recognition, source control, universal precaution, additional precaution, administrative control, environmental control, engineering control, while framing your answer. And try to give it an organized look, like going for the primary prevention first. That is where, what do you do under this? You provide information on preventable control measures, adopting WASH, that is including water, sanitation and hygiene. In vaccination, addressing the myths and misconceptions. Focus on the training, logistics and risk communication. Ensure safe practices in the community. That is the ASHA, A&M and FLWs to communicate for preparedness in the face of COVID-19 outbreak at the community level. Vaccination, contact tracing as per the SOPs, that is the standard operative procedures. Implementing home quarantine, home care and supportive services for the high-risk groups and probable cases of urban and rural areas, and address the psychosocial care and stigma and discrimination. Because as we have noticed quite obviously, that is particularly in the first phase of COVID-19 pandemic, the stigma was very well felt. Now coming to secondary prevention, ensure early diagnosis and referrals through panchayat level committee, maintain and record the travel histories, infection prevention and control, that is IPC practices. The PAC and CSC medical officer in charge should familiarize himself or herself with the Ministry of Health and Family Welfare's guidelines for infection prevention and control in the healthcare facilities. Team safety and prevention to be given a thrust point. Coming to the tertiary prevention, supportive supervision, reporting and feedback are the major crux areas. So in this way, what happens, the prevention and control, any question comes context of COVID or some other disease, try to organize and base your answer on the levels of prevention and segregate those points according to primary, secondary and tertiary prevention. Another very important question this year, I have observed, many of the colleges had their long question around ASHA, full form of ASHA, what is the role of ASHA, what message would ASHA give on community on protection regarding COVID. So basically, even as short notes, so ASHA has been a very popular choice while framing the question for the examiners this year. So this question was actually about what message does an ASHA give to the community on protection from COVID-19? Well, protection measures for everyone. One can reduce one's chance of being infected of spreading COVID-19 by taking some simple precautions. Regularly and thoroughly cleaning your hands with alcohol-based hand rub or washing them with soap and water. Maintaining at least 1 meter distance between yourself and anyone who's coughing or sneezing. Avoid touching eyes, nose and mouth. Make sure the person concerned and the people around them follow good respiratory hygiene. This means covering the mouth and nose with their bent elbow or tissue whenever they are coughing or sneezing, and then dispose of the used tissue immediately. And stay home if the person isn't feeling well, and if the person has fever, cough and difficulty in breathing, medical attention should be immediately sought and call in advance. Follow the direction of the local health authorities. Protection measures for persons who are in or have recently visited in the past 14 days in area where COVID-19 is spreading. So the travel history is also one of the important areas the ASHA should be focusing on. Another important question in context of COVID-19 is the modes of transmission. So try to give it in a organized way as in this, pictures. So it will save your time as well as give the examiner a good impression of your answer. Another important area is the, IMNCI best questions, where diarrhea is quite a favorite and its management outline. So in this particular context, you have to, see that wherein your particular description of the child fits in. So if the signs and classification and subsequently the action to be given. So if in your question paper there is mention of diarrhea for more than 14 days or more with dehydration, you have to classify as severe persistent diarrhea and treat accordingly to the guideline. But if there is no dehydration but diarrhea is there for 14 days or more, you have to classify under persistent diarrhea. But if there is not enough signs to classify as some or severe dehydration, the classification would fall under no dehydration. If there is blood in the stool, it will fall under dysentery. And if their child is restless, irritable, sunken eyes, drinks eagerly, is thirsty, the skin pinch goes back slowly, you have to categorize the child as suffering from some dehydration. And then you have to mention the plan B and elaborate it. But if the child is lethargic or unconscious with sunken eyes, not being able to drink or even if drinking very poorly, the skin pinch is going back very slowly, then the classification falls under severe dehydration, and then you have to mention the plan C while elaborating. So coming to another very important question, this is the maternal mortality rate definition. Mention the important causes of MMR and discuss the preventive and social measures to reduce MMR. Do remember, maternal mortality is defined by World Health Organization as the death of a woman from pregnancy-related causes during pregnancy or within 42 days of pregnancy, expressed as a ratio to 100,000 live births in the population being studied. And increased family planning and safe abortion combined with consecutive increased skilled birth attendant, improved care before and after birth, reduced home birth and improved emergency obstetric care, essential obstetric care that involves institutional delivery and skilled attendance during birth, emergency obstetric care that involves operationalizing of the first referral units or FRUs, strengthening the referral system as such, making good use of national health programs like JSWISE and JSSKs are the basic points to be built on while writing the strategies to bring down maternal mortality. So you have to mention the health strategies as under the INAP and make mention of MCTS, how to detect the high-risk pregnancies, the line listings and appropriate managements, equitable access, maternal death review. Even maternal death review is important as a side question or maybe a short note. So do go through it. Identify the villages with high number of home delivery and distribution of misoprostol. Family and community level, you should mention the safe birth attendance and clean birth practices. Mention the 7 cleans. Outreach level, identify the complications and timely referrals, pre-referral dose of corticosteroids and antibiotics. Health facility level, EMOC and management of preterm level. And just little briefing about maternal death review. It is about the maternal death audit, the verbal autopsy from family members at community level to know the medical and non-medical causes. A maternal death review basically provides a rare opportunity for a group of health staff and community members to learn from the event, which is in many cases largely preventable. And maternal death review should be conducted as a learning experience. It's not about pointing out or for going for some punishment. The purpose of the maternal death review is to improve the quality of safe motherhood programming to prevent future maternal and neonatal morbidity and mortality. Usually the community-based maternal death review comes more frequently, but it can be also facility-based. This year the question around ASHA, their eligibility criteria, their roles are very important. In fact, the functions of ASHA in context of any health programs is also probable. You need to specify the eligibility criteria in a proper fashion and mention the role with due emphasis on each of these facets. And while framing your question, if it is given in context of a particular program or a particular health service, you have to tag it. Maybe the maternal and child health services delivered by ASHA. So you have to frame accordingly. Again, as I said, the dog bite, you have to justify that why this category 2. So best is write down the 3 categories and then mention that since it fits into such and such description, hence belongs to category 1 or 2 or whatever it is. And then mention the local treatments. In the vaccination regime, while you are mentioning the doses, it is always good if you mention which regime you are mentioning, with the Zareb regime or the SN regime. Please mention it. Now the question that also came in some colleges, that how to increase the couple protection rate. Here your answer should be again forming on the lines of a particular framework, that is situational analysis, setting objectives, resource, priority fixing, plan formulation, counseling and implementation of different methods, behavioral change communication, and of course monitoring and the evaluation of the same to go back to the situation analysis again. As you know, the couple protection rate is the main factor to reduce the net reproduction rate, and it should be giving the figures for the same, national figures, and how the usage of contraceptives in our country depends on the knowledge and availability of the contraceptives. And the couple also have the fear of side effects of contraceptives at the same time. And the women often do not have the deciding powers. To get consent of the partner sometimes becomes a difficult issue. So the objective would be to increase the couple protection rate. And the resources that you will be talking about are basically 3 major resources, as manpower, material and money, and mentioning and building on those headings. And the priority fixing would be the gap between the woman's reproductive intentions and their contraceptive behavior. The unmet need rises as more women want to control their fertility but are not practicing any contraceptive method for one reason or the other. And the unmet need falls as more and more females use contraceptives. So then you have to mention your plan formulation, how you want to go about the counseling and implementation of different methods, the behavioral change communication aimed at improving the CPR, and how to monitor and evaluate. Here is just a framework for jaundice outbreak, but it can come in context of food poisoning, malaria, dengue, whatever may be there. You have to build your answer on certain basic guidelines where you have to carry out the verification of diagnosis, confirmation that if there is an existence of an epidemic or an outbreak, define the population at risk, make a rapid search of all cases, carry out the data analysis, formulate the hypothesis, test the hypothesis, then evaluate the ecological factors involved, then further investigate for the population at risk, and of course, no investigation is complete without writing a proper report of it. And on the left hand side, you will find some more elaborate guidelines to go for kind of questions. Now coming to the disaster ones. You should know the definition of disaster, the different types of disaster, and as a BMOH, certain guideline I'm giving you to build your answer on, like a formal planning for managing disaster is necessary. Why? To ensure the minimization of hardship for the population. And this is achieved through a pre-planning, a proper sequence of response actions, getting triage on ground, allocation responsibilities to the participating agencies or the stakeholders, effective management of the resources so that the resource is optimally utilized, developing codes and standard operating procedures for smooth coordination between various departments and all the relief agencies involved, organization of communication, information and warning systems, ensure maximum community participation, and the objectives of any multi-hazard district disaster management plan should be localize a disaster and to the maximum extent possible contain it, so to minimize the impact on life and the environment and the property. It should begin with the analysis of the disaster episode in the block, follow it up with the evaluation of the at-risk areas. Here you need to mention like the map showing the cyclone prone areas, or if it is a flood related question, map showing the flood prone areas. If it is flood, you have to mention the construction of flood cells with control rooms, identifying the low-lying areas, communication of the regarding the rain and river gauge reports, hiring of boats within time, necessary arrangement will be done as and when required, sluice gates and regulators to be kept track of, removal of crossspuns and fishing pattas. So this is basically a flow diagram how these at the block level the disaster management cell is interlinked between the BDO to the control room, from the rural health centers or BPHC, and again from the PHC to the BPHC as well as the control room, the GP headquarters sub-center, the Gram Panchayat, and from the Gram Panchayat again to the control room. So there is a lot of coordination in between these. The BMOH to ensure the following important measures, like taking preventive measures to reduce the risk of disease transmission, ensure immediate investigation of reported outbreaks and diseases, initiate control measures and evaluate ongoing sanitary and public health activities intermittently in the rescue camps and in the affected areas, availability of resources to be ensured like ORAs, antimalarials, antibiotics, insecticides, snake venoms, zinc tablets, LLINs, water quality testing kits, organizing epidemiological surveillance till normalcy established, that is the camps are withdrawn, sanitation and water supplies restored, and many more. And of course, public education programs. And they should also ensure that the daily reporting about the following diseases is carried out, and even sending of zero disease report to be emphasized, like malaria, diarrheal diseases, cholera, respiratory infections, infective hepatitis, typhoid, skin diseases, measles, snake bite, eye infection. And the only other thing to be reported daily is death due to house collapse. Along with this, at all levels, one should also ensure availability of safe drinking water, safe disposal of night soil, and health awareness and personal hygiene. So basically sums up the management problems, and one also needs to know the diseases probable due to the disasters. It may be death, injury, or other morbidities, which are direct ones. Then in the indirect ones, due to the disruption of the basic life support systems and facilities like drinking water, sewerage system, altered living conditions, other unfavorable environmental conditions such as weather, etc. It may lead to major surgical, medical, psychological, or public health problems. And the risks commonly encountered after disaster, which are of concern for health authorities, are based on population displacement. Due to this, there may be overcrowding at the new places, leading to transmission of local diseases, health problems specific to the temporary shelters, altered population density, changes in the pre-existent levels of various diseases on a long-term level, disruption of the basic public health services like drinking water, excreta disposal, shelter arrangement, food arrangement, and all these can lead to increased workload or work pressure on the existing health infrastructure, and the psychological manifestation due to loss of property, loss of life of near and dear ones. So basically you need to have some framework in terms of pre-cyclone preparedness, how to track a cyclone, and post-cyclone measures in case of a cyclone-oriented question, just like the way we discussed in context of floods. So do remember, prevention is always better than cure. So do study when you have still enough time before your exams. So all the very best, and if you are new to this channel and haven't subscribed, please do subscribe to my channel. It won't cost you a penny, but it will definitely motivate me to bring more academic contents for you, which will certainly go a long way in helping you. So stay tuned, and for that press the bell icon for immediate intimation whenever I am putting up any new academic content. Thank you so much. Until then, happy studying.